Tak především žena, která...
If you are considering using Aniball, carefully read the instructions for use, including the safety precautions, and familiarize yourself with the contraindications. If you have any doubts, feel free to contact us. The contact information can be found on our website. Bear in mind that Aniball's main function is not to stretch the birth canal and perineum, but it helps you practice conscious relaxation of the birth canal for a smooth passage of the baby. After using the balloon for some time, you should feel that the balloon tends to come out freely without having to forcibly push it out as you inhale, and goes back in a little bit as you exhale. The aim is to automate this simple principle and understand that it is important for the mother to breathe properly during childbirth in order to make the passage of the baby smooth. You should not hold your breath and tighten the anal sphincters. Remember to breathe deeply instead. First of all, do not use Aniball earlier than from week 37 of your pregnancy. Be calm and relaxed when practicing. Try to create a pleasant atmosphere. Do not rush anywhere. Do not focus on the fact that you have to practice, but rather use relaxing music or aromatherapy. Use anything that helps you to be calm and feel good. Take your time and breathe properly. The insertion of the balloon is often difficult for many women during the first days. Bear in mind that it is completely normal. Keep calm, do not stress or hurry. Be kind to yourself, and if you feel that it is not going well, simply leave the practice for the following day. The insertion of the balloon is individual. Some women inflate it a little and use a lubricating gel before inserting it. Others deflate it completely and roll it up. It is important to breathe during the insertion. Do not hold your breath and do not hurry. As I already mentioned, be kind to yourself and never insert the balloon further if you start experiencing pain or a feeling of discomfort. During the first few days, you should first of all get used to the feeling of pressure that the balloon causes. Learn to react to it with the help of breathing. The inserted balloon should not cause pain or any discomfort. At the same time, it should not slip out, and it should only create slight tension. That is the right size of the balloon for practicing. Practicing breathing is also part of the process. Take a deep breath into the abdomen and then breathe out. Pay attention to what the balloon does during inhalation and exhalation, and repeat this 10 times. It tends to come out with inhalation and comes back in a little bit with exhalation. This is harder to perceive during the first few days. Some women have trouble feeling anything at all, and over time, day by day, they get acquainted with this simple principle. Our breathing is connected to the relaxation of the pelvic floor and, on the contrary, the tightening of the pelvic floor during the breathing cycle. There is no need to concentrate on the achieved Aniball size. Inflate the balloons to a maximum of 5 presses, especially during the first few days. It is not really necessary to measure it, but rather to listen to your body. If it's painful, you can reduce the size of the balloon at any time. Do not rush. It is also important to note that in the first few days, a woman should not focus on forcing the balloon out, because it usually does not go very well. It is natural and, in fact, the birth canal gets hormonally prepared only as the date of the childbirth gets closer. The balloon will eventually get pushed out, step by step, thanks to gradual practice. During the first few days, there is no need to rush. Do not try to get the balloon out at all costs. Rather, focus on practicing your breathing, then deflate the balloon and pull it out freely. It is important to realize that you don't need to compare yourself to other mums and friends. It is not a race in the achieved size or centimeters. It is completely irrelevant. This pressure on performance does not play any role in the prevention of perineum injuries. Well, it's definitely not about pushing for the best performance. Each woman should be kind to herself and respect her body's signals. Bear in mind that this extreme stretching of the birth canal occurs only during childbirth. It is only possible thanks to a special cocktail of hormones and thanks to contractions. Preparation activities done with Aniball, which most women do daily, are not aided by all these factors. That's why it doesn't make any sense to constantly increase centimeters and try to make the balloon bigger at all costs, especially if it hurts. Quite the opposite. Each woman, especially during the first few days, should not exceed 5 pump presses. Try not to measure the balloon. Do not focus on the size. Listen to your body. Yes, definitely. Because we know that practicing with Aniball is not about the best performance. You don't have to practice with Aniball every day for 3 weeks. It is enough to use it only a few times in order to understand the principle of relaxation. In general, after your birth injuries heal, but not before the end of the postpartum period, which should be a period of rest and connecting with the baby. Start practicing with Aniball after the postpartum period.